Nuri Mal is head of the pancreatic cost action. There's a lot of activities happening on pancreatic cancer recently at the EU level and national level. How can we coordinate these actions? What actions need to take place? And where should we go now to develop treatments for pancreatic cancer patients?
Well, there's different actions that have been now going on. One of them regards to research. And in research, there's the EU funds cost action. This is a platform on 22 countries' research groups and research groups that participate in this action. And we are trying to build a platform regarding different or considering different aspects from standardizing methods and tools that we all can use in the same research projects, so that then we can pool these resources. The second big aspect is regards to omics, omics biomarkers coming from the omics big initiatives, big data. The third is how to translate this research into the findings from this research into the patient management, and finally is the patient management.
Jasmina Koeva from the Bulgarian Personalised Medicine Association. EAPM is a smart approach to personalised medicine, which is smaller members and regions together. Bulgarian Personalised Medicine Association has been set up 2 years ago. What are the activities that they're doing, and what activities will they be doing based on the Council conclusions on personalised medicine?
Right now, Bulgaria is undergoing a major reform in the healthcare. And we think that this is the right moment to establish the basis on implementation of personalized medicine in Bulgaria, on not only the right treatment for the right patient, but in the right way. That's why we've planned a number of activities, and we're communicating the concept and the principles of personalized medicine to different stakeholders, like the Ministry of Health, the government, the Health Commission with the Parliament, National Insurance Health Fund. So we apply multi-stakeholder approach. And we've joined the Consultative Council to the Council of Ministers that is helping the implementation of the healthcare reform. So we're given expert opinions, and now we've planned to develop, and we've already set up the task force groups to develop a national strategy for development of and implementation of personalized medicine in Bulgaria. That should be ready somewhat end of November, and ready to be set for discussion and then implemented in the healthcare strategy 2020.
Wim Widget from the European Association of Urology. Urology and personalised medicine, is there a connection? And if there's a connection, what can we do to support the urology community?
Yeah, there is a connection, but not really that strong like in, for example, breast cancer, lung cancer, and as we saw today, leukemia. For those diseases, you have a specific biological or genomic marker indicating what kind of treatment you need. For prostate cancer, it's not that far yet, but it's not far away also. For castration-resistant prostate cancer, for example, there is for certain patients with biological identifiers, there is a real indication to use a certain drug for that's olaparib. And it's only a publication that has been recently published last year, I think. And the results need to be confirmed in the future because it was only, say, approximately 60 patients. But we are going to move in that direction, in the same direction as breast cancer and in the same direction as the other cancers I mentioned.
And what can EAPM do to support this?
Yeah, well, that's a good question. Having seen all the actions from today, we can educate our urologists, our residents, in what is the level of evidence that we need for specific markers being judged by everybody in the urological world as the marker for a certain disease or for certain diseases. On the other hand, we are now using prognosticators for high risk, for determining high risk versus intermediate versus low risk prostate cancer, and for those high risk patients, we have now the opinion, now the possibility to treat them with a curative intention, radical prostatectomy, or with, but that's still experimental, focal therapies in localized prostate cancer.
Kaiser Immonen, Director of Policy for the European Patient Forum. Today we had a conference on personalised medicine, over 80 speakers, 200 delegates. What do you take from the sessions related to personalised medicine, patients and health literacy?
Well, I think that one thing that's come out really strongly from today's discussions, which were very interesting, was the need to have a much, much better awareness amongst the patients, but also the general public on what personalised medicine is, what genomics are, and what implications of genomic sequencing exist for people's ability to make better decisions about their health. So I think we need initiatives on health literacy targeted at patients, but also the general public, and we need to improve the skills of health professionals to communicate concepts such as risk, genetics, epigenetics, and so on to patients.